about HIV and AIDS. It's an epidemic and a pandemic disease that is still a problem today. It's not just a disease that is happening in Africa. A lot of people have HIV, and so and it's prevalent in the United States, not as severe as in Africa and other regions, but it is still happening today. The objectives today is you want to be able to define what HIV is and AIDS. You want to understand how HIV progresses to AIDS. You want to know what cells are affected by the HIV virus. Be able to identify the common signs and symptoms of HIV and AIDS. Understand how HIV virus is spread. Know the stages of circumversion. Understand why it is difficult to completely eradicate the HIV virus in the body and why we still do not have a vaccination for it. And know the oral implications of the HIV virus, be able to identify it in an oral cavity, how it looks like. So what is HIV and what is AIDS? It's also called human immunodeficiency virus and acquired immunodeficiency syndrome. HIV causes AIDS and it interferes with the body's ability to fight infections. The virus destroys a type of white blood cell. Yes, are you raising your hand? Oh, no. The virus destroys a type of white blood cells in the immune system called T helper cells. And this makes copies of itself inside the cells. T helper cells are also referred to as CD4 cells. So if you see both of those, it's the same. They just have different names. HIV destroys more, as HIV destroys more CD4 cells or T helper cells in the body, it makes more copies of itself. And then it gradually breaks down a person's immune system. And if you have a weakened immune system, your body is not able to fight infections. And so that's what makes HIV really bad. The speed of the HIV progresses depending on the age and the health and the background of the person. AIDS is not a virus. It's just a set of symptoms or syndrome caused by the HIV virus, but it's not a virus. A person is said to have AIDS when their immune system is too weak to fight off infection and they develop certain defining symptoms and illnesses. AIDS is the last stage of HIV, and this is when the infection is very advanced, and if left untreated, it can lead to death. And this is a chart that pretty much tells you the difference between HIV and AIDS. It tells you about the CD4 cells, what they are, what is HIV and what is AIDS, and so it just gives you a little difference. So the stages of circumversion, you need to know what the primary, when you have a primary HIV infection, the early symptomatic HIV, and the late stage of AIDS. You want to know the different counts for each one. Circumversion is basically the period of time during which HIV antibodies develop and become detectable. Circumversion generally takes place within a few weeks of initial infection. So once you get the HIV infection, they won't be able to actually detect it until about a couple of weeks or a couple of months after the initial exposure. It is often, but not always, accompanied by flu-like symptoms, including fever, rash, muscle aches, and swollen lymph nodes. Your CD4 count is one of the most important measures of immune strength for people with HIV. The number of CD4 cells in the bloodstream is known as your CD4 count. So you'll need to know the different stages of the circumversion. And then how is HIV spread? You can get it through sexual transmission, perinatal transmission. If a mother has HIV infection and is not treated, she can pass that on to her child throughout her pregnancy, through breastfeeding. And you see a lot of this in underserved countries in Africa. They don't have the resources for treatment. So when the mother has HIV, she doesn't get treated for it, and so when she's pregnant, the baby will also get HIV. And you get blood transfusion with syringes, drug users sharing and reusing syringes, and so that's how HIV is spread. You cannot get HIV from kissing, hugging, sharing food, insect bites, toilet seats, bathing, sneezing, coughing, sweat. Basically anything that goes inside of the body, blood, anything fluids, that's how you can really get HIV. So know the difference between how you can get it and what ways you cannot get HIV. You need to know the signs and symptoms of HIV and AIDS. The major signs, this is most common in advanced stages of HIV when it progresses to AIDS, is weight loss. You'll see a lot of people that have AIDS, they're really skinny. Their immune system is really weakened at this point. You'll have chronic diarrhea, prolonged fever. The fever actually lasts for months. And then minor signs, this is more prevalent and when you first get the HIV infection. So you'll get a persistent cough over a month. You'll have generalized dermatitis, recurrent herpes, oral pharyngeal candiditis, and so these are just the initial infection. And these are the complications of AIDS. This is what makes AIDS very really bad when it leads to death, because all of the organs in the body at this point are being affected by AIDS, and this is how it ultimately leads to death. So your lungs are affected by it, your heart, everything becomes affected at this point. Yes?
Is that also referring to the objective question on why is it difficult to completely eradicate the HIV virus of the body? Because if it hits so many organs that it's almost impossible, or no? Or is that refer more so to the
I'll get to that on one of the slides.
Oh, sorry.
Oh, no, it's fine. But no, AIDS, so what makes AIDS different than HIV is, HIV is like the initial exposure, but if it's not treated, you're given antiviral drugs. So when someone gets HIV, you're given a cocktail, multi-drugs, and so this is going to actually prevent it from getting AIDS. So you can have HIV and still have a normal life. You're always going to have HIV. It doesn't leave the system because it's not vaccinated, and I'll get to that in one of the slides. But what makes AIDS deadly is because it does affect all of the organs, and at this point your immune system is compromised. And so you get a lot of opportunistic infections. Your body at this point is not able to fight a lot of infections. And so that's what makes AIDS deadly, but not so much HIV if it's treated early. Did that answer your question? I'll get to it on one of the slides on why we don't have a vaccination for it. Some of the oral effects of HIV and AIDS, you get dry mouth, enlarged lymph nodes, but what you need to know as a clinician is that your patient will have candidiasis, also known as thrush. You'll see hairy leukoplakia, also called the Epstein-Barr virus. And then, as mentioned, Ms. Matthews said that in clinic, some of the students have seen a patient with linear gingival arrhythmia. And so you can also see that in a patient as well as canker sores. The herpes simplex virus is also common oral effects of it. So this is really important. Opportunistic infections are infections that occur more often or are more severe in people with weakened immune systems, such as people living with HIV or people receiving chemotherapy. A weakened immune system makes it harder for the body to fight off HIV-related opportunistic infections. So here are some of the oral implications of the HIV. right over here. So this one right here is Kaposi lesions. They're like little black lesions around the skin. Hairy leukoplakia right over here is lateral side of the tongue. This is another picture of it right here. And this is thrush, candidiasis on the tongue. And so these are common signs of HIV. And then this is linear gingival arrhythmia. Basically, it's a persistent linear erythematous border around the gum line. They easily bleed, so if you're probing, they'll easily bleed. They're linear gingivitis lesions. They're generalized. Some can be localized, and they're most common. And then lesions usually undergo spontaneous remission. And so these, this is a picture of Magic Johnson. I don't know if you know who he is, but he's a basketball player. Well, he was a basketball player. And in 1991, he announced that he had HIV. And HIV actually was not really recognized until 1981. And then it wasn't until a couple of years after that when there was a test that was developed to detect someone that has HIV. Magic Johnson is still alive today, still has HIV, but the reason why he does not have AIDS is because he takes a cocktail of multiviral drugs. And so this helps him progress into AIDS. And so that's why I have a picture of him right there. And the cocktail drugs are called multiple antiviral drugs, also called HAART, which stands for highly active antiretroviral therapy. And this basically decreases the patient's total burden of the HIV. It maintains the function of the immune system, and it prevents opportunistic infections that often leads to death. So there is treatment available that can prevent it from AIDS occurring into the body. So there is currently no cure for HIV or AIDS. The treatments, as mentioned, can slow the course of the condition and allow most infected people to live a relatively long and healthy lifestyle. Early HIV antiviral treatment is crucial. HIV is treated, again, as mentioned, with antivirals. The treatment fights the HIV infection and slows down the spread of the virus in the body. Generally, a patient can take a combination cocktail of medications called HAART. So why is there no cure for HIV? HIV disrupts the body's natural disease-fighting mechanisms. Like all viruses, HIV gets inside an individual cell in the body, but it disrupts their machinery to make thousands of copies of itself. Vaccines, which induce the production of antibodies that recognize and bind to very specific viral surface molecules, are not effective in fighting the HIV virus. This is because throughout infection, HIV surface molecules are continuously changing. HIV replication is especially hard for the body to control because the white blood cells it infects, it eventually kills. And we need those white blood cells for our immune system to fight off infections. The mutation rate is so high during replication because the HIV reverse transcriptase lacks proofreading abilities, so it doesn't catch its own errors when copying its RNA. And I'm gonna have to upload this video.
That's the question, I mean, that's the answer to your question, Carla.
Yeah, and I have that, I guess I just wanted to make sure that was I wanted to confirm that, so thank you.